Today you might have noticed that a few members are not around. The DG NCDC is away on tour of the states along with the WHO representative. So if you have questions for them, we'll bank them, or we'll ask the Minister of Health to respond. This afternoon, we're marking a milestone as will be unveiled by the chairman in his remarks. Let me quickly now invite him to the podium to make his remarks, after which the Minister of Health and the National Coordinator will update us in successive order. I now invite the Chairman of the Presidential Task Force on COVID-19 and Secretary to Government of the Federation to please come to the podium to make his remarks. Mr. Chairman, sir.
I'm not sure I will be able to speak quite loudly with my new school uniform. But I can see that some of you are putting on some T-shirts that have some... why didn't you extend it to us? Okay. Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, I welcome you all to the national briefing for Thursday, 18th of June, 2020. Yesterday, Wednesday, 17th June, 2020, made it exactly 3 months since the Presidential Task Force on COVID-19 was inaugurated and assigned the task of putting in place sustainable measures for the control of the spread of the virus and strengthening our healthcare systems to withstand the deadly virus and prepare for the future. The Presidential Task Force was given a timeline of 6 months for its assignment. You will recall that the terms of reference given to the Presidential Task Force include the following. 1, to strengthen the national response strategy, particularly in the areas of testing, containment, and management of COVID-19. 2, strengthen collaboration with all tiers of government, private sector, faith-based organizations, civil societies, donors, and partners. And 3, build awareness among the populace. 4, direct the deployment of any relevant national assets when necessary. 5, lay a foundation for scientific and medical research to address all emerging infectious diseases. And lastly, 6, advise government on the declaration of national emergency as part of the containment measures when necessary. It is therefore very apposite that the Presidential Task Force on COVID-19 undertake a midterm review to ascertain the extent to which it has been able to achieve the set objectives. There has no doubt been some modest achievements, challenges, and lessons learned over the past 3 months. The COVID-19 is certainly the greatest invisible public health emergency that has threatened humanity in modern history. As at the last recorded numbers on Wednesday, 17th June 2020, global figures of confirmed cases were 8,408,203 persons, resulting in 451,463 deaths in 213 countries. Unfortunately, as at the same period, Nigeria accounts for 17,735 infections and 469 fatalities. Ladies and gentlemen, these are not just numbers. They are our brothers, sisters, mothers, fathers, friends, and colleagues. These fatalities are forceful reminders of the task before us all. Although the Presidential Task Force has planned a full midterm report with larger stakeholder groups on 2nd and 3rd of July 2020, we nevertheless find it necessary to share with you some of the high points of the last 3 months. The Presidential Task Force has the following functional working areas through which it implements its objectives. They are Presidential Task Force National Pandemic Response Center, coordination, epidemiology and surveillance, risk communication and community engagement, laboratory, security, logistics and mass care, points of entry, resource mobilization, infection prevention and control, research, case management, and lastly, finance monitoring and compliance. Since inception, several measures have been instituted by the federal government of Nigeria through the Presidential Task Force on COVID-19 to curtail the spread of the disease and protect the health of Nigerians. These include: 1, initial lockdown of Lagos and Ogun states, as well as the Federal Capital Territory. 2, ban on flights to prevent importation of the virus. 3, ban on interstate travels and domestic flights. 4, closure of schools and religious centers. 5, imposition of nationwide curfew. 6, easing of the lockdown in phases to allow for gradual reopening of the economy. And 7, prescription of measures to be observed to prevent spread, such as mandatory use of non-medical masks, coverings in public places, mandatory provision of hand-washing facilities and sanitizers, extensive temperature checks in all public spaces, physical distancing of 2 meters between people in workplaces and other public places, prohibition of gathering of more than 20 persons outside of a workplace. In addition to non-pharmaceutical measures, the following capacity has been developed: expansion of the testing laboratories from 2 to 38 as of today. Trained over 13,000 health workers in infection prevention and control. Develop policy and protocols for testing returning Nigerians. Develop policies and protocols for integration of primary health care into the national response. Developed stronger and sustainable policy for community engagement and risk communication. Collaborated with development partners to boost our resources and enrich our capacity for technical response. And lastly, raise the isolation center bed space from 3,000 to over 5,000 nationwide. Let me, at this juncture, acknowledge the leadership and guidance of His Excellency President Muhammadu Buhari who has consistently supported and encouraged the Presidential Task Force. The support received has been a huge boost to the determination of members to succeed. I similarly acknowledge the collaboration of other committees set up to address the impact of COVID-19 and the collaboration from the Nigerian Governors Forum. The Presidential Task Force consistently pursued a national response that was underpinned by science, data, and global experiences that placed a high premium on our local peculiarities. The importance of this approach is further underscored by Mr. President's call during yesterday's extraordinary China-Africa Summit on solidarity against COVID-19 through a video conference, which the Honorable Minister of Health and myself were privileged to attend, when he called for knowledge sharing as a fundamental aspect of dealing with this pandemic globally. Like the rest of the world, our national response continues to face challenges, especially as there is no known cure for the virus presently. These include inadequate infrastructure, manpower shortage, global shortage of essential items like test kits and PPEs, strain on the economy, which has compelled the need to balance between lives and livelihoods. By far, the greatest challenge are human resistance to change, stigmatization, mental health, skepticism, culture, religious belief, rising incidences of domestic violence, and a host of others. Ladies and gentlemen, the COVID-19 has changed our ways of life, and we may never go back to what we used to know. As we push the frontiers of research at domestic and international levels, the debate on which drugs will be clinically suitable also continues. With our reliance on data and science, we eagerly look towards crossing the threshold of experiments into a wall of cure. We continue to encourage our researchers and scientists to rise up to the occasion by submitting to the validation processes. The Presidential Task Force position is that every treatment regime must be supported by incontrovertible evidence of science and processes. The Presidential Task Force wishes to express its appreciation to our diverse stakeholders for their support and commitment to the cause of humanity. This includes the health workers, who we used to know as our frontliners, but as from last week are now our last line of defense. Security agencies, state governments, the private sector, traditional and religious leaders, international community, professional bodies, and public-spirited Nigerians. Your contributions have been highly instrumental to our present level of progress. Ladies and gentlemen, the journey ahead of us all is even more important than the last 3 months. As you are aware, the main focus is on community engagement and risk communication, while not neglecting the need to obey all guidelines and non-pharmaceutical measures. We therefore crave your buy-in so that we can collectively become champions in the efforts to wipe out the virus. Always remember that the virus is near and is real. potent and dangerous. Our relaxed lockdown should never be interpreted to mean otherwise. This point is further underscored by reported resurgence of a second wave in countries like China and the United States. And this should put all of us on the alert, knowing that this virus can only be eliminated if we agree to play our part. This call becomes more pertinent as we go fully into rainy season that ordinarily brings with it cold, catarrh, and other COVID-19 mimicking illnesses. Our call to take personal responsibility cannot be more stringent than now. As we go forward, therefore, let us look forward to another 3 months of overwhelming successes. Let us create awareness and sensitization. Let's stop stigmatization of survivors, and let's encourage fellow citizens that have contracted the virus to enable them overcome the illness. Our choice of words matter. Our attitude and reactions to them would help to boost the stability of their mental health and encourage them on the path of recovery. All combined will help our efforts to test, detect, trace, isolate, and treat. I now have the privilege to call on the Honorable Minister of Health, thereafter followed by the National Coordinator, to update you this afternoon. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation and Chair of the Presidential Task Force on COVID-19, Honorable Ministers here present, Permanent Secretaries, National Coordinator, Directors, ladies and gentlemen of the press. The Nigeria Center for Disease Control yesterday announced 587 new confirmed COVID-19 cases in Nigeria, increasing the total tally to 17,735 cases. We have treated and discharged 5,967 persons, and 469 persons have sadly been lost to the disease. We have said that the increasing number of cases should be a warning that the fatalities could be increasing too. But there are measures and strategies we can take to limit the fatality rate. The first is that since majority of fatalities are persons over 50 years of age or have pre-existing ailments like diabetes, cancer, hypertension, kidney disease, HIV, tuberculosis, etc., this group of citizens, which have been labeled the vulnerable citizens of COVID-19, can be specially protected. This protection begins with them limiting their exposure to risks of COVID-19 infection by opting to stay at home, except when there is an urgent need and dire need to go out. Also, by opting to wear a face mask or a face covering at any time they are outside the house or when inside the house with persons who may have been exposed. To observe all other non-pharmaceutical advisory like frequent hand washing, social distancing, respiratory hygiene, sanitizer use, etc. I must emphasize that going to places where there can be a crowd, like a market, or also places of sports, places of entertainment, or places of worship, carries risk of increased exposure because you do not know who is standing next to you or who is standing in front of you or behind you. I also want to stress that being in a closed room or a closed environment increases the risk of exposure to infection in proportion to the number of people and the length of time spent in there with them. Because the likelihood of the presence of a person who is COVID positive increases with the number of people, and also the risk of infection would increase with the time spent there, it's the time of exposure. All persons in the vulnerable group that I have just mentioned who test positive ought to go immediately to a treatment center immediately in their own best interest. Because a vulnerable person is not among those who should risk staying at home because complications can arise more easily and more suddenly, or at an odd hour of the day or night when there will be no immediate help available. Also, any person generally who tested positive and opted to stay home or elsewhere should move to a treatment center at the very earliest sign of fever or shortness of breath or any symptom. A delay can be fatal because the disease progression can be unpredictable, sudden, and faster than imagined. With these important measures, we could mitigate fatality rate as the number of cases increases. The novel coronavirus is still among us and it's infecting people daily, including even prominent members of society, and many of them surprised and not knowing exactly how this infection came about. Till it goes away, whenever that is, we must take extreme precaution when going to public places. I also had the honor yesterday of joining His Excellency the President at the China-Africa Extraordinary Summit on Solidarity Against COVID-19 Pandemic, where the desirability of sharing knowledge from research and experience was emphasized, as the PTF chairman has already reported. This is of value to us because China has considerable experience with this COVID-19 problem. Earlier yesterday, we also signed a bilateral agreement with the Democratic Republic of Korea on cooperation in the area of public health and medical science, and the agreement is to start cooperation between both countries in the areas of exchanging experience in public health and health science and primary health care management, facilitating visits by scientists, and exchanging information on research. On Monday, 15th of June, we inaugurated the Governing Council of the Pharmacists Council of Nigeria, where the council was charged to discuss aspects of the profession to meet up with the realities of today, as COVID-19 pandemic has brought medicine security in Nigeria to the forefront. We have updated case management guidelines with reviewed changes like discharge criteria and medication used for the treatment of COVID cases. Our treatment centers will also be getting an advisory to test the applicability of a drug recently repurposed and announced as being effective for treatment of COVID-19. The engagement of states and support for them in management of COVID-19 in their centers will continue to increase with increased capacity building. The Ministry of Health will also be prioritizing the procurement of oxygen generators alongside ventilators, because our experience so far shows that oxygen supplementation is in high demand and very helpful in treatment of COVID-19. Thank you all for your attention.
The chairman of the PTF, honorable ministers, members of the PTF, gentlemen of the press, good evening. My theme for today is the issue of enforcement of our protocols. The PTF continues to be very concerned about the issue of compliance. As you are aware, we are here to push for the containment of COVID-19 in the country through data-driven medical advisories. The fact that we are receiving many reports on the flouting of the guidelines by individuals, groups, and organizations is simply unacceptable. As I've said in the past, COVID-19 is far from over globally. Neither is it over in Nigeria. There's no doubt that a lot of community transmission is happening, and it continues to increase across the states. Now, more than ever before, if you go out, you are more likely to get COVID than before. Your risk of acquiring COVID because of the numbers we have now is more than 3, 4 weeks or 5 weeks ago when we had a lockdown. So there really isn't any room for relaxation at this point. The reason why we had to relax the lockdown was in order to sustain the livelihoods of Nigerians, particularly those who depend on a daily income for survival, as well as to sustain our economy. But it wasn't because COVID has gone, and it wasn't because we should be more relaxed in terms of our prevention measures. In order to balance the issue of livelihoods with public safety, we issued advisories, we issued protocols that will guide the relaxation of the lockdown in order to mitigate the high risk of transmission of the virus among us, and to also ensure public safety. We have noticed that a lot of people do not wear masks in public spaces. It is mandatory for masks to be worn in public spaces. Masks are supposed to cover your nose and mouth. They are not meant to cover your chin. There are also concerns about physical distancing and the issue of mass gatherings. We'll particularly note the issue of social gathering and organizations going for concerts against the lockdown protocols by the federal government. We are working with the security agencies to put in place enforcement when it comes to organizations that flout these guidelines. We will not sit back and allow public safety to be endangered by a few. While we are very much aware of the challenges that people continue to have because of the guidelines that we have issued, but these guidelines are there for a specific reason. They are there to protect us. They are there to protect public safety. We know that some businesses have been fined or even closed due to non-compliance. There have also been various levels of enforcement using the police, mobile courts, and in some cases charges being brought against the parties. It is easier to change behavior if you do so voluntarily, and this is why we are increasing our level of risk communication and community engagement, pushing public awareness activities right down to the grassroots level. We are aware that times are challenging, but this is the new normal for COVID. It is the new normal that we really have to abide by. And the question we should really be asking ourselves repeatedly is, do we want to be the next COVID victim? If the answer is no, then we definitely owe it to ourselves, to our communities, to our loved ones to adhere to the safety measures provided. The PTF will do whatever we can to stop further transmission of the virus and to save lives. But to do so, we also need to accept personal and collective responsibility for our actions. We plead with the public to please understand with our measures and to personally challenge those that continue to put us, our loved ones, or our communities at risk of COVID infection. Thank you.
Thank you very much. We shall now take your questions.
Good evening, all. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like to direct my first question to the National Coordinator. We have just about 3 days to the tentative 21st of June. I was set for the opening of the sky for local flights. I'd like to know, what feelers are you getting from the operators? Are they meeting up with some of these requirements for reopening? Or you think the tentative date, there will be need to shift it? My second question, I will appreciate it if the PTF chairman will be able to give a response to it. Is the PTF doing anything to address the impasse between the Ministry of Health and the resident doctors? The last time that the Ministry of Health and the Ministry of Labor met with them, the meeting ended in deadlock. And the comment from the ministries that were trying to reconcile the challenge shows that there is a threat for dismiss these doctors should they continue with the strike. On the side of the doctors, after that meeting, till now, they still insist on the strike. We know the effect this could have on the fight that the PTF is coordinating. So are you thinking of intervening so that this impasse will be resolved? I also like the Minister of Education to respond to my next question. It has to do with universities, especially the private universities that are charging full tuition from students, even though there have not been lectures and there is no date in mind for the resumption. Many of the universities, especially the private ones, are already forcing students to pay their full tuition fees. I don't know what the Ministry of Education is doing. My other question is actually for the Minister of Foreign Affairs. Unfortunately, he's not here. All right, thank you.
Good afternoon, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the coordinator. Sir, the Nigerian COVID-19 response has been threatened by social stigma and discrimination. And I don't know if we have guidelines to address associated stigma and discrimination around COVID-19. And are we also looking at having maybe like a helpline centers where Nigerians can call in to get psychosocial support? More so, I don't know if we're looking at using past experience with major epidemic like tuberculosis and HIV to address stigma around COVID-19. My last question is for the Minister of Health. Sir, Nigeria has the capacity for validating drugs at the moment and test kits and other medical consumables. One will wonder, why have we not deployed the platform for the products locally? To deploy the platform, this platform locally, so that we can also have our own test kits, we can also have our own drugs, not just validating. My next question is, I don't know if we are factoring neglected tropical diseases to fight COVID-19? Many thanks.
Good evening, Chairman and members of the Presidential Task Force, my colleagues. My name is Mitaire Ikwe and I report for the NTA. My first question, I'm taking it from where my colleague stopped earlier. The National Association of Resident Doctors has threatened that their colleagues in isolation and treatment centers nationwide will join the strike in 2 weeks. Within 2 weeks, if their demands are not met. What is the PTF doing to ensure that we don't get to that precarious point where those that provide care for COVID-19 patients have to pull out? And for the Minister of Health, health workers in the Federal Capital Territory are still complaining of shortage of personal protective equipment. We understand that a COVID-19 case was confirmed in the gynecology unit of the Wuse General Hospital, and the unit was shut down and decontaminated. After 3 days, the health workers there have been asked to report back at work, but they are adamant because they feel they are not adequately protected. So what are we doing to address this issue of shortage of personal protective equipment? And finally, as a way of suggestion concerning the continued rejection of patients with other ailments, which is leading to avoidable deaths, which the PTF has made reference to severally, I want to suggest that the PTF should create a desk, maybe in its health committee, with officers and numbers that Nigerians can call or affected persons can call as a way of addressing the problem which is still lingering. Because I know my understanding of a task force is that task force circumvents protocol and bureaucracy. Because at the moment we are still having the issue of rejection of patients, which is still causing avoidable deaths. Thank you.
Good afternoon, sir. The SGLs, honorable ministers, my colleagues. My name is Abiodun Omolara Oloyede Popola. I'm from Voice of Nigeria. I report in Yoruba. So I'm going to ask my question in English and also in Yoruba. So I'm going to ask in Yoruba the Minister of Interior, Ogbeni Rauf Aregbesola. Then the Minister of State of Health also is going to answer the question. And also my Minister of Information also is going to answer in English and Yoruba. My question, sir, to Minister of Interior Affairs. Sir, the people in the prison, I don't want to say people in the prison, the prisoners, the correctional services. Sir, I want to know much about what is really happening there in this area of pandemic. Because there was a research, and we found out that some of these people are complaining within themselves that they are not properly taken care of. And at the same time, some of them also have symptoms of COVID-19 and they are not being taken care of. I want you to please say it in English and also in Yoruba. Thank you very much. My Minister of State, sir, of Health. Sir, some people will take their people to the hospital for the cure of COVID, or maybe, sorry, let me start with some other ailments that have the symptoms of COVID-19. And they will be deprived of having attention. And before you know it, that person will give up. What are you really trying to educate the personnel, the medical personnel, for them to understand there are differences between the symptoms of COVID-19 and other ailments? Sir, in English, sir, the Minister of Education, some schools now are asking their students to pay for their third time when they have not even finished this time already. What are we saying about it? Then my minister, sir, the only thing I want you to do for me, sir, is just to explain in Yoruba the new guidelines that we have now. Thank you very much, sir. Okay, sir. The new guidelines that we had on Monday, because I was trying to explain, they said they really want it from the voice of Nigeria. And the voice is our Minister of Information.
Good evening, honorable members of the PTF team. My name is Juliana Taiwo Baloye. I have just one question for the coordinator, please. Coordinator, please. The Road Public Transport Owners of Nigeria Association says 3 weeks after they've submitted their proposed guideline and protocols to NCDC, which they applauded, they are yet to hear from the PTF. They said the continuous ban has created a very lucrative black market in interstate travel. So they want the PTF to answer. They are saying the PTF is somehow promoting corruption in this area because people are traveling at night, paying illegal transport companies money to travel. So they want to hear from you a date when the ban will be lifted for them to start their business and assurances from you. Thank you.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. Let me start with you, Mr. Chairman. I remember some time ago I brought to your notice that security agencies who are working under the federal government have not been paid their allowances or even received palliative of whatsoever. Now, I did a personal investigation and I found out that that story is still the same. It may also interest you to know that even those who are working under the Presidential Task Force on COVID-19, the security agencies have also reached out saying that they have not received their allowances. And this question I asked some time ago, and you promised to do something about it, but these complaints keep coming up. So I want you to react to that. And still staying with you, sir, over the week, I remember over the weekend the Naira Marley concert that was held somewhere in Jabi that generated lots of controversy. At the moment, the place has been sealed up. My question now, is there a way the Presidential Task Force can intervene through the FCT? Because most of the people there that have shops are actually coming up to say that it looks as though they are the ones paying for the sins of the organizers in Naira Marley, looking at the fact that some of them are still recovering from the lockdown. Is there a way you can intervene, looking at the fact that this is a PTF, so there can be a way out for these people? And finally, to the Minister of Interior, you weren't here on Monday and last week. I asked the same question. I said there was a training for those who were newly recruited for Correctional Center, their workers, and there was a training for them in Lagos before the COVID-19. And during the COVID, they were told to go back home. But as we speak, they have been called back for that training in Lagos. Looking at the fact that the numbers in Lagos are the highest in Nigeria, what assurances are you giving these people of their safety? That's the question. Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ude. I report for Rise News. And my first question goes to the Minister of Health. Dexamethasone. Well, that is the drug that the WHO has called the drug of hope, especially for those who eventually get to the stage where they would need ventilators. Well, yesterday the NCDC said Nigeria is not looking to use this drug. And I do know that your ministry, you come up with a regimen that we use for treating those in the isolation center. So we need an explanation as to why we're not considering this drug in the country, even though countries like South Africa and even Kenya are telling us that they are seeing positive results in terms of fatality of those who eventually use the ventilators. And staying with you, sir, well, the figures you reeled out last week concerning that ministerial task force that was sent to Kano as regards to that unexplained death, you said between 50 and 60%. Well, the Kano state government, they've done their own investigation and they said only 15.9% were COVID-19 related. So I'd like to get your comments on that. And finally, to the national coordinator, well, there are some calls coming in now. They said, if you're able to allow those who have lost loved ones, you give them exemptions to travel to the village. What about those who plan to get married traditionally? Is there some sort of exemptions that you can give to them? Because they're saying, yes, for the church weddings and all the sorts of weddings, you can do it virtually. But for traditional weddings, you have to go home and meet the family. So I'd like to get your take on that. Thank you.
Mr. Chairman, members of the PTF, my colleagues, my name is Mohamed Salih Nazif. I work for Voice of Nigeria. My question first goes to Health Minister. With the issue of threat coming from medical doctors going on strike and other issues that they have been complaining about, what are we doing at the moment to rescue that situation before it reaches that ugly point? Secondly, the other time you talked about the volunteers. In the event these people decided to go on strike, are we bringing more volunteers? Because since the last time, we haven't had the specific role those volunteers are playing in this period altogether. And secondly, again, on the issue of psychosocial therapy that you talked about, of which to me I understand is all about soft medicine. And some people are talking about spiritual therapy. Will you consider adding that one in the program for victims of COVID-19? And to my information minister, when we look at the narratives going on concerning COVID-19 at the moment, it appears, if I can go back to some of the statistics you gave us on the research concerning awareness conducted in Nigeria, that how many percent are aware, certain percentage are still doubting and all of that. It appears this number this time around is giving a different thing, or is speaking a different thing altogether. And that is why the coordinator was complaining, people are not complying. So what is the problem? Does that mean people no longer, it's not as if they are not aware. They are aware that this thing exists. But why is it they are finding it difficult to accept and comply with these things? Is there any strategy, new strategy that we are going to apply in communicating these messages to them so that they can comply? Thank you very much.
Thank you. It looks as if we have a full basket this afternoon. That's a question for everybody to respond to. So we have the questions directed at the Honorable Minister of Health, the Honorable Minister of State for Health, the National Coordinator, Honorable Minister of State Education, Honorable Minister Interior, Honorable Minister Information and Culture, and the Chairman of the PTF. So let's begin, as usual, with the Minister of Health.
Thank you. I'll go straight away to the question of common multiple interest, and that is the question of the Resident Doctors, National Association of Resident Doctors, which I deliberately did not speak about during my presentation just now. I had a deep meeting with the resident doctors this morning in my office. They came in, opened the door, we had a real frank discussion. It is clear that there are some things they are frustrated about, perhaps justifiably, and many of the things they reported did have merit. And what I had to make clear to them was that we work within a system where things follow certain processes, and they appeared to listen very carefully to me. In fact, they were very attentive. I think we had a very good rapport. They spoke and we spoke. And to understand that we work within certain systems, and there are many of those observations they made, which can be remedied easily, like the one for personal protective equipment, which, as a matter of fact, has been distributed widely in 2 phases. First of all, to each state government, and secondly, to every tertiary hospital in all the states. So if I hear now that there is a shortage in FCT, I'm surprised, because FCT is the closest to a warehouse. We have warehouses in Lagos and warehouses in Abuja and other places. So I'm not sure that the information about the PPE is correct, because I have personally prioritized the issue of personal protective equipment. I've also pleaded for rational use, because we import most of all of these, and if we use them anyhow, we can easily run out. But nevertheless, we make sure it's available in all the places where it's supposed to be used. There are countries in the world where there was shortage. In fact, there was global shortage of everything. If you look at foreign news, you will have seen that there's shortage everywhere. But we haven't really had that shortage. There are places in Europe where they had to use rubber from dustbin linings and so on. So we be very careful that we keep a stockpile, and anywhere there's a shortage, it is immediately remedied. We're using a digital system to make sure that there is an electronic system to make sure that the management of commodities of that nature is properly documented. And I asked yesterday for a report. I got it this morning, a thick file of distribution of PPE. I have it on my table right now, well documented, supplied everywhere. Sometimes it may be that the warehouse of the particular facility has not given it out. I don't know, but we are on the central side here doing everything to facilitate distribution of PPEs. Now, the young doctors also had some erroneous belief that we could here dictate what goes on in other states. There are certain complaints which they have, not with the federal government, not with the Ministry of Health, but with certain states, which we say that we can only put in a word, but we can't, we can put in a good word, but we can't deal with the problem within a state, administrative problem within a state. So we'll put in a word, we assure them of that, but they shouldn't have the impression that we can solve problems that occur in specific states. We do have a means of advocacy to request and also sometimes worry some governors to attend to certain issues regarding doctors. So that one was cleared up. And the few other things they brought up are easily cleared. We can take care of those ones. They're not big problems, issues of discipline and so on, which we can take care of. So I do believe, and I'm sure that they will reconsider. We had a very frank talk, and I look from how attentive they were, that they understand the situation. We also explained that this COVID period is not a good time to withdraw service, because people's lives can be at risk. Maybe the life of someone you know, maybe the life of a relative. And there's nothing that is really so such that anybody who can be hurt during this process should be left to be hurt. So they appear to appreciate that very well. And because COVID does not discriminate between anyone at all. So they appear to understand that, and I believe that they will do the right thing and cover up and go back to the duty as assigned. With regard to spiritual therapy, well, I think that's left to anyone can request of spiritual therapy during their period of treatment. You can request for your pastor or your imam or any other psychologist or whatever to come, but we provide psychosocial support. We provide psychologists. We provide psychologists generally, and psychotherapy and psychosocial support. We can do that. But that spiritual therapy is open to everybody according to their needs and according to their own request. Now, the Kano Task Force submitted a report, and there's a slight variance with what the Kano State government announced yesterday. We are going to call our experts to review the two. They may have used different methodologies to look at this case, but we are going to look at the two findings. They are not totally far from each other because they do admit that a certain percentage of the unexplained fatalities were due to COVID. There is a slight variation in the percentage that is attributed by either side. So we are going to look at it, but other factors that were brought in will be looked at and examined. Now, I did mention that there is medicine that is, we're going to ask for our clinicians to try, and I think it's Amaka who came and put a name to it. I didn't put a name to it because I didn't want people running around going to look for medicines. These are not medicines you should be using. These are medicines that the doctor is to use. And the doctor uses it. Luckily, this medicine is not new. It's well known. It's used for other purposes. It's a steroid that is used generally for many other purposes and was found to be useful in this case. So it's easy to try it out because, number one, you already know it. You know the side effects. You're not dealing with something where you have to worry about the side effect. If you are dealing with a new discovery, you look at the short-term side effect and the long-term side effect and the harm it can do. But this one is already well known, so there's little risk of the fears. Secondly, the usual dosage is also well known. So, and it's also medicine that is not terribly expensive or terribly unavailable. So we are going to ask our clinicians to also consider adding it to their trials and seeing what results it works in our own circumstances for this particular problem. With the question of the rejection of patients at treatment centers, that is something we have been preaching against. We have always said that the least you can do is do a triage, examine a patient, and give them an advice. Because if you give somebody an advice of what to do, where to go, it is also the medical help, in that you give them guidance on what to do. So that is something we expect every practitioner to do. Even if you are not on duty, you can do that. And it is not something that the government supports at all, that you reject patients and you don't give them any treatment. And with regard to the neglected diseases, yes, neglected topical diseases, whether neglected routine activities like immunization, antenatal, none of those should be neglected. We want this service to go on. It is true that there has been a decline in the services being offered, routine services being offered at our hospitals, both public and private. We want those figures to get better. In all the missions that we have entered, we have always sent people from family health and people from primary health care to ensure that they restore and revive the problem of lack of reducing service to routine cases. So the test kits, all test kits, whether they are domestically produced or they are imported, are put to verification. They have to be validated, all of them. There is no difference. So those agencies responsible for validation carry out that duty, and it is when they have done it, they give you their go-ahead to use it. So in some cases, they give you a number, like NAFDAC, they give you a number, so you see a NAFDAC number, you know that it's okay. So it's not depending on whether it's produced locally or out of in other countries. So so we have already, I think, covered most of the questions, all of the questions. Health, they were quite related to each other, some of them. Sorry? Volunteers, yes. Volunteers we have called for right from day one. We have always called for volunteers. We have called for all those who have retired and are willing to join us to come forward. So right from the day, if you look at our announcements we have made here, we have been calling for volunteers from day one. So the matter of volunteers is not new. And we have, in fact, a column for volunteers, for the kind of support we shall give to them, for the kind of insurance support volunteers will get. That's already a part of our program. So it's not a new thing. And we are calling for volunteers to still come out, as we have said, to support the effort, because we require more effort. Some doctors are working excessive hours. There are some of them are doing double shift, and there are cases where some patients with very, very serious problems require many hours of a doctor's attention. So yes, we have been calling for volunteer nurses, volunteer doctors, volunteer laboratory scientists, and so on. And so that is something that is ongoing in our strategy. Okay.
I think I had 2 or 3 questions. The first one had to do with the issue of social stigma and discriminations. The Honorable Minister of Information will be talking on that in greater detail, but I do agree on the importance of psychosocial support. I guess, well, spiritual support will probably be part of psychosocial support. Your suggestions about a helpline is useful. We'll look into it. Obviously, it will require a lot of training. I know we do have links with a particular hospital or institution here in Abuja in terms of looking at the psychological aspects of COVID. But as the pandemic itself progresses, this will become an even greater issue, more and more. In terms of transport guidelines, we actually had a detailed presentation today at the PTF meeting of a submission by the Federal Ministry of Transport on the changes required as we relax the lockdowns over the next few weeks. So we are aware of some of the guidelines, and we'll be incorporating some of the suggestions into our next set of guidelines for the exemption. Essential travel, traditional marriages. Well, obviously we cannot compare people that are traveling for the purpose of bereavement with those that are traveling for the purpose of marriage. Of course, I'm not saying marriage is not important, but I'm sure even the in-laws themselves will be quite worried if you are at risk of transporting COVID to them while you are asking for marriage. But we treat every case on its own merit, and we will look at all submissions, and if they fall within our definition of essential travel, we will give them exemptions. Thank you. Oh no, so we don't have a specific guideline, I'm afraid, but we will take that up and have a look at it. As you know, I'm sure you've been on the NCDC website. We have numerous guidelines, and we will look at the psychosocial side. It probably isn't going to be hugely different to our experience with HIV. Certainly with HIV, we have been working with some of the community support systems that have to do with HIV currently in the rural areas and down to the communities. They have been helping us engage in terms of public awareness campaigns. So the experience that they have in terms of stigma, etc., will also come in. But as I said, the Honorable Minister of Information will also provide additional information. Thank you.
Thank you, National Coordinator. Quickly, I will bring up the Honorable Minister of State for Education.
Everybody, just to say, the question relates to private universities and later private secondary schools who have been asked to pay fees. The federal government does not regulate how you conduct those areas you call private. Anything private means you have taken government out of it. So we regulate how they become institutions, but how you decide to pay is a value proposition. If you feel you don't get value, you report to the Consumer Protection Council. Thank you.
So we'll take the remaining responses in this order. The Honorable Minister of State for Health, followed by the Honorable Minister Interior, the representative of the Honorable Minister Aviation, then the Honorable Minister Information and Culture. So we begin with the Honorable Minister of State for Health.
Thank you very much, Mr. Chairman of PTF, my colleagues in PTF, media representatives here present, distinguished ladies and gentlemen. I think it's just one question for me. I would have loved that Abiodun from Voice of Nigeria, I would have loved that you asked your question in Yoruba. So it would have been easier for me to respond as appropriate, but be that as it may. I think essentially translated, it's like you asking for the guidelines for medical personnel to take care of ailments that are not COVID-19. I hope I got that right. Okay. Well, when you say guidelines, probably the most important guideline at this point in time for any practitioner in any of the hospitals is to take or consider every patient that comes as being COVID-19 until proved otherwise. When you have that kind of approach, then you try to play safe. I mean, it's just applying wisdom. But having said that, you do know that in clinical practice, you could have a clinical diagnosis based on history and examination of your patient. So that at the end of it all, you have a kind of what we call provisional diagnosis. But oftentimes, you may need to now ask for some investigations to be able to make very clear diagnosis. Because diagnosis of an ailment is probably the most important part of patient management, because you cannot treat what you don't know. So having said that, in the case of COVID-19, no matter how the presentation appears to be in terms of history, in terms of symptoms, signs, in terms of your examination, you will necessarily need to do laboratory diagnosis. And that is having your PCR test to confirm, and then you know what to do thereafter. So I can then try and say that in Yoruba. Arábìnrin wa Abiodun láti Voice of Nigeria. Mo rò pé ìbéèrè tí ó ń bi wá ní wípé kí ni àwọn nǹkan tó dàbí pé a lè pè ní àwọn nǹkan tó di ṣíṣe lẹ́sẹẹsẹ fún àwọn òṣìṣẹ́, pàápàá jùlọ dókítà àti nọ́ọ̀sì àti àwọn tí wọ́n ń ṣe ìtọ́jú fún àwọn aláìsàn. Mo sọ níwájú àmì síwájú nínú ọ̀rẹ́ mi tí mo sọ léde Gẹ̀ẹ́sì wípé ní àsìkò tá a wà yìí ó máa jẹ́ nǹkan tí ó di dandan fún yàn láti ṣe wípé tí dókítà kan bá wà nílé ìwòsàn, gbogbo ẹni tó bá ti wá ní àsìkò tá a wà yìí ó yẹ kó kọ́kọ́ wò yí pé ó ṣeé ṣe kó jẹ́ pé ẹni tó ní àrùn COVID-19 ni. Nídìí eléyìí olúwa ẹ̀ á lè gbáradì wípé èmi gan tí mò ń ṣe ìtọ́jú aláìsàn mi ò gbọ́dọ̀ kó àrùn yìí. Nípa ìyẹn ni ìfura wípé ẹnikẹ́ni tó bá ń láti ṣe ìtọ́jú fún aláìsàn ní àsìkò tá a wà yìí nínú ilé ìwòsàn ó ní láti ní ìfura tí àwọn Yorùbá ń pè ní ogun àgbà, wípé ìfura ní ogun àgbà. Kó ní ìfura wípé ó ṣeé ṣe kí ẹni tí òun fẹ́ ṣe fún ní ìtọ́jú báyìí ó ṣeé ṣe kó jẹ́ pé àrùn COVID-19 ni. Tí ó bá ti ní ìfura báyìí á lè jẹ́ kí ẹnìyẹn náà kó gbáradì nípa irú ìtọ́jú tó máa ṣe fún. Ìkejì ni pé nígbà tí aláìsàn bá wá rí dókítà tí a bá ń béèrè lọ́wọ́ ẹ̀ pé nǹkan tó ń ṣe ẹ́ yìí ń jọ́ ló bẹ̀rẹ̀, kí ni àwọn nǹkan tó ń ṣẹlẹ̀. Ibi tí a bá ti ń béèrè gbogbo eléyìí a ti máa fi sí ọkàn yìí pé ó ṣeé ṣe pé ibi tá à ń lọ rẹ̀ nípa irú àìsàn tí ẹnìyẹn ní. Ó ṣeé ṣe kó jẹ́ pé a lè má lè sọ yìí kó di dandan ká lọ ṣe àyẹ̀wò láti lè sọ yìí pé nǹkan tí ẹni ní nìyẹn. Ṣùgbọ́n ní ti COVID-19 ó di dandan wípé láti ṣe àyẹ̀wò nítorí pé àwọn nǹkan tí ẹnìyẹn bá gbé wá bóyá wípé àìlèmí kanlẹ̀ ni o àbí ara gbígbóná ni o àbí ikọ́ àbí ọ̀fun dídùn. Àwọn nǹkan míì náà wà, àwọn àìsàn míì wà náà tó lè tí yẹ pé ó lè mú àwọn nǹkan báyìí dání. Ìyẹn ló ṣe pàtàkì fún COVID-19 wípé a ní láti ṣe àyẹ̀wò yẹn láti lè rí ní pàtó wípé ohun tí ẹnìyẹn gbé wá sí ilé ìwòsàn nìyẹn. Pàápàá jùlọ tó fi di wípé tí a bá ti lè rí pé ní dájúdájú ohun tí ẹnìyẹn gbé wá nìyẹn, a ní láti fi sí ward ọ̀tọ̀. A lè gbé lọ sí ward tí àwọn tí wọ́n ní àìsàn tí ò ń ṣe COVID-19 wà. Ó dẹ̀ tún di dandan wípé tí a bá ti rí ẹni bẹ́yẹn a ní láti ṣe ìwádìí wípé àwọn ta ni wọ́n jọ ń gbé pọ̀. Ó ṣeé ṣe kó jẹ́ ìyàwó nínú ilé ni, a fẹ́ béèrè pé baálé ńkọ́, àwọn ọmọ tó wà nílé ńkọ́. Bákan náà ká lè rí pé a ṣe àyẹ̀wò fún wọn kó má bàa kó bá àwọn tí wọ́n jọ ń gbélé. Àwọn eléyìí jẹ́ àwọn nǹkan tó wà nílẹ̀ lẹ́sẹẹsẹ gẹ́gẹ́ bí ìbéèrè tí arábìnrin wa ń béèrè. Ó dẹ̀ di dandan wípé ó ní láti ní àkọsílẹ̀. Ìyẹn la fi ń mọ̀ wípé òye báyìí ni a rí láti ilé ìwòsàn báyìí báyìí. Àádẹ́ tún wá ro gbogbo ẹ̀ pọ̀ láti lè mọ òye tá a ní ìlú yẹn àti ní ìpínlẹ̀. Mo rò pé mo ti gbìyànjú. Ẹ ṣé o. Thank you.
Good evening, all. Here and outside. The questions are: one, what is the situation in the custodial centers? How are we doing?
Are there infected inmates or staffers? The answer is this on that. The officers and men of the Nigerian Correctional Service deserve encomiums for their professionalism, for their very, very high sense of duty, for their diligence and their commitment. How and why? I've said it here before, I'm just simply repeating it. What they have done there is almost extraordinary. It's common knowledge that our centers accommodate more than the number of inmates that are supposed to be there. I won't be specific now, but that is a well-known fact. So for the officers of the Nigerian Correctional Service to have succeeded in preventing any outbreak, not one person in our care at the custodial centers or as staffers of the service is reported to have COVID-19 so far. Cynics want to say, Rauf, you are here again. What of the reported incident in Bauchi last week? I want to preempt that by telling you that what happened in Bauchi is this. You know, soon after the lockdown, we had the approval of the president to restrict or prevent visits and admission of new inmates. So, throughout the first phase of the total lockdown, which was in April, we did not allow any visit to the custodial centers, and we did not admit any new inmate into the custodial centers. This was facilitated by the directive of the president, which the NJC supported, because courts proceedings and operations too were largely suspended. So the pressure, though there, was not high. But with the ease of the restriction, with the relaxation of the restriction, which came into effect at the second phase, June, in response to that, and strictly following the protocol established by NCDC, we selected some of the centers with isolation facilities. So, in the case of Bauchi, some courts on the 4th of June this year remanded some capital offensive suspects, about 14 of them, which we put through the procedure of testing. And the 14 of them tested positive. And they were promptly rejected by the custodial center there. But the state government insisted that they had no place to keep them. They were kidnappers, armed robbers, suspects. I'm not saying they have not been convicted. They are suspects of capital offenses. So an agreement was therefore reached between the custodial center officers and state government that they will be kept in isolation unit in the custodial center under the care. The state will be treating them. I mean, the Bauchi state government will be treating them, will be feeding them, but they will be in isolation. So they are not in any way mixed with the regular inmates of the custodial center. They are being managed by our officials and the officials of the state government. That's about that. So, what I'm saying in essence is that there is none
of the inmates in our charge in the custodial centers that has any manifestation, symptom, if I'm going to use your lingo, of COVID-19. I made mention of this in my performance account at the FEC, and I'm equally telling you now that the Nigeria Correctional Service has displayed a high level of dedication, diligence, and professionalism in the management of the custodial centers under his care. That's about that. The second question is about training schools. I could have appropriately just said that, look, let's give it to these people that they are professionals. And for as long as there are protocols already established by NCDC and the PTF, I want to believe they are working in tandem with those protocols, and that that should be enough to give us the confidence that no harm will come to those people who are in training. But I won't just leave it at that. I want to be more specific. By January of this year, 2,211 senior and junior officers of the service began a training program in 5 training centers nationwide, Lagos inclusive. But by April, when the lockdown came, when the total lockdown came, they were all asked to go back to their respective homes. The one thing we must bear in mind is that they are within the region. That is, nobody will come from Kaduna to Lagos. No, the people in Lagos who are in Lagos are officers in the Lagos territory. With the east lockdown, which began in June, they were therefore asked by the 5th of June to reconvene to complete their training. I said 2011 were on training in January, and they were recalled to complete their training in June, on the 5th of June specifically. So far, 1,868 have reported. We are still awaiting 343. Nationwide, not only in Lagos, nationwide, 5 centers. And they have been on the training following the guidelines and protocol established by the NCDC and the PTF. And to the glory of God, to date, we have not recorded any victim of COVID-19. So your fear should be allayed with that. And I want to conclude by saying that what this time calls for is what our chairman said the last time he spoke here. We must all take personal responsibility for our safety and protection. From personal responsibility on this pandemic, let's extend it to communal responsibility, and so on. So if we are all so prepared, definitely we will manage it as we are going, as we are cruising on. The world is struggling to combine saving lives and protecting livelihoods. And that is the key to me, that's the key slogan now. As we are committed to saving lives, we cannot equally dismiss the fact that people must live. The lives that we are saving must be able to live. And living is not just breathing. It's earning a livelihood to support your life and those who are dependent on you. The Yoruba of what I've said in English. She asked me Yoruba. She said, I must say Yoruba. She said, okay, I'm saying the Yoruba one. I listened to her. She said she was in English and Yoruba. And I can't dress like this and refuse to speak Yoruba. Àkọ́kọ́
ohun tẹ́ béèrè ní pé báwo la ṣe ń ṣètọ́jú àwọn tó wà ní ìpamọ́ torí a lè pé lọ́gbà ẹ̀wọ̀n mọ́ ń sìn ìpamọ́ àti tún orí wọn ṣe torí correctional center náà ń pè lóyìnbó ń sìn kó ṣọ̀gbà ẹ̀wọ̀n mọ́ ìpamọ́ ìjọba àti tún orí wọn ṣe àwọn tá a fẹ́ kọ́ lọ́gbọ́n tá a fẹ́ kọ́ lẹ́kọ̀ọ́ láti lè rí ayé gbé pẹ̀lú àlàáfíà ìrọ̀rùn tí wọ́n àti tàwọn aráàlú ohun tá a ti ṣe ń bẹ̀rẹ̀ o a wà lára àwọn orílẹ̀-èdè tó rí ètò ìtọ́jú àwọn tí ó wà ní ìkámọ́ ìjọba ṣe tí ò tíì sí ẹnìkan tó ṣe àgbákò COVID-19 ní àgbáńlá ayé àwọn orílẹ̀-èdè tó rí ṣe wọ́n pọ̀ o ṣùgbọ́n orílẹ̀-èdè wa ó wà lára àwọn tó rí ṣe tí ò sí ẹnìkan ní gbogbo àwọn tó wà ní abẹ́ ìtọ́jú wa about 75,000 people ló wà in our consular service 75,000 people kò sí kan nínú wọn tó ní àrùn COVID-19 láti ìgbà tí àjàkálẹ̀ àrùn ti wọ orílẹ̀-èdè wa tí ìgbà tí ń sọ̀rọ̀ yìí àwọn 14 tí ìwé ìròyìn sọ pé ó ní lọ́sẹ̀ tó kọjá wọn ò sí nínú ààbò tiwa o ìjọba kóòtù Bauchi àwọn ló ní pé ká gbà wọ́n sọ́dọ̀ torí pé ohun tó ń mú wọn fún àwọn ẹ̀sùn tó lágbára ni tó yẹ pé tán bá dájọ́ wọn tán ẹ̀mí ló máa bá lọ àwọn ìgárá ọlọ́ṣà àwọn ajínigbé ni wọ́n nígbà tó ń kó wọn dé ilé iṣẹ́ wa ní Bauchi a ní pé à ń gbàyàn tá a bá ṣàyẹ̀wò fún àyẹ̀wò tá a ṣe fún wọn ló fi wọ́n yí pé 14 wọn o wọ́n ti láwọn COVID lára adẹ̀kọ̀ wọn aláàlè gbà wọn ìjọba bọ́ọ̀lù sọ fún wa yí pé ibo làwọn fẹ́ kó wọn sí àwọn ọ̀daràn pọ́nbélé lélẹ́yìí torí ìdí èyí ẹ jẹ́ ká jọjọ ṣe agreement kẹ́ bá bì kan fi wọ́n sí lọ́dọ̀ yín tó hàn fi ní ráyè dé ọ̀dọ̀ àwọn tó kù.
Thank you very much, Mr. Chairman of PTF, my colleagues in PTF, media representatives here present, distinguished ladies and gentlemen. I think it's just one question for me. I would have loved that Abiodun from Voice of Nigeria, I would have loved that you asked your question in Yoruba, so it would have been easier for me to respond as appropriate, but be that as it may. I think essentially translated, it's like you asking for the guidelines for medical personnel to take care of ailments that are not COVID-19. I hope I got that right. Okay. Well, when you say guidelines, probably the most important guideline at this point in time for any practitioner in any of the hospitals is to take or consider every patient that comes as being COVID-19 until proved otherwise. When you have that kind of approach, then you try to play safe. I mean, it's just applying wisdom. But having said that, you do know that in clinical practice, you could have a clinical diagnosis based on history and examination of your patient. So that at the end of it all, you have a kind of what we call provisional diagnosis. But oftentimes, you may need to now ask for some investigations to be able to make very clear diagnosis, because diagnosis of an ailment is probably the most important part of patient management, because you cannot treat what you don't know. So having said that, in the case of COVID-19, no matter how the presentation appears to be in terms of history, in terms of symptoms, signs, in terms of your examination, you will necessarily need to do laboratory diagnosis. And that is having your PCR test to confirm, and then you know what to do thereafter. So I can then try and say that in Yoruba. Arábìnrin wa Abiodun láti Voice of Nigeria. Mo rò pé ìbéèrè tí ó ń bi wá ní wípé kí ni àwọn nǹkan tó dàbí pé a lè pè ní àwọn nǹkan tó di ṣíṣe lẹ́sẹẹsẹ fún àwọn òṣìṣẹ́, pàápàá jùlọ dókítà àti nọ́ọ̀sì àti àwọn tí wọ́n ń ṣe ìtọ́jú fún àwọn aláìsàn. Mo sọ síwájú nínú ọ̀rẹ́ mi tí mo sọ lédè Gẹ̀ẹ́sì wípé ní àsìkò tá a wà yìí, ó máa jẹ́ nǹkan tí ó di dandan fún yàn láti ṣe, wípé tí dókítà kan bá wà nílé ìwòsàn, gbogbo ẹni tó bá ti wá ní àsìkò tá a wà yìí, ó yẹ kó kọ́kọ́ wò yí pé ó ṣeé ṣe kó jẹ́ pé ẹni tó ní àrùn COVID-19 ni. Nídìí eléyìí, olúwa á lè gbáradì wípé èmi gan tí mò ń ṣe ìtọ́jú aláìsàn, mi ò gbọ́dọ̀ kó àrùn yìí. Nípa ìyẹn ní ìfura wípé ẹnikẹ́ni tó bá ń láti ṣe ìtọ́jú fún aláìsàn ní àsìkò tá a wà yìí nínú ilé ìwòsàn, ó ní láti ní ìfura tí àwọn Yorùbá ń pè ní ogun àgbà, wípé ìfura ní ogun àgbà. Kó ní ìfura wípé ó ṣeé ṣe kí ẹni tí òun fẹ́ ṣe fún ní ìtọ́jú báyìí, ó ṣeé ṣe kó jẹ́ wípé àrùn COVID-19 ni. Tí ó bá ti ní ìfura báyìí, á lè jẹ́ kí ẹnìyẹn náà kó gbáradì nípa irú ìtọ́jú tó máa ṣe fún. Ìkejì ní pé nígbàtí aláìsàn bá wá rí dókítà, tí a bá ń béèrè lọ́wọ́ ẹ̀ pé nǹkan tó ń ṣe ẹ́ yìí ń jọ́ ló bẹ̀rẹ̀, kí ni àwọn nǹkan tó ń ṣẹlẹ̀. Ibi tí a bá ti ń béèrè gbogbo eléyìí, a ti máa fi sí ọkàn yìí pé ó ṣeé ṣe pé ibi tá à ń lọ rẹ̀ nípa irú àìsàn tí ẹnìyẹn ní. Ó ṣeé ṣe kó jẹ́ pé a lè má lè sọ kó di dandan ká lọ ṣe àyẹ̀wò láti lè sọ pé nǹkan tí ẹni ní nìyẹn. Ṣùgbọ́n ní ti COVID-19, ó di dandan wípé láti ṣe àyẹ̀wò, nítorí pé àwọn nǹkan tí ẹnìyẹn bá gbé wá, bóyá wípé àìlèmí kanlẹ̀ ni o, àbí ara gbígbóná ni o, àbí ikọ́, àbí ọ̀fun dídùn. Àwọn nǹkan míì náà wà, àwọn àìsàn míì wà náà tó lè tí yẹ pé ó lè mú àwọn nǹkan báyìí dání. Ìyẹn ló ṣe pàtàkì fún COVID-19 wípé a ní láti ṣe àyẹ̀wò yẹn láti lè rí ní pàtó wípé ohun tí ẹnìyẹn gbé wá sí ilé ìwòsàn nìyẹn. Pàápàá jùlọ tó fi di wípé tí a bá ti lè rí pé ní dájúdájú ohun tí ẹnìyẹn gbé wá nìyẹn, à ń láti fi sí ward ọ̀tọ̀, a lè gbé lọ sí ward tí àwọn tí wọ́n ní àìsàn tí ò ń ṣe COVID-19 wà. Ó dẹ̀ tún di dandan wípé tí a bá ti rí ẹni bẹ́yẹn, a ní láti ṣe ìwádìí wípé àwọn ta ni wọ́n jọ ń gbé pọ̀. Ó ṣeé ṣe kó jẹ́ ìyàwó nínú ilé ni, à fẹ́ béèrè pé baálé ńkọ́, àwọn ọmọ tó wà nílé ńkọ́. Bákan náà ká lè rí pé a ṣe àyẹ̀wò fún wọn kó má bàa kó bá àwọn tí wọ́n jọ ń gbélé. Àwọn eléyìí jẹ́ àwọn nǹkan tó wà nílẹ̀ lẹ́sẹẹsẹ gẹ́gẹ́ bí ìbéèrè tí arábìnrin wa ń béèrè. Ó dẹ̀ di dandan wípé ó ní láti ní àkọsílẹ̀. Ìyẹn la fi ń mọ̀ wípé òye báyìí ni a rí láti ilé ìwòsàn báyìí báyìí. Àádẹ́ tún wá ro gbogbo ẹ̀ pọ̀ láti lè mọ òye ta ní ìlú yẹn àti ní ìpínlẹ̀. Mo rò pé mo ti gbìyànjú. Ẹ ṣé o. Thank you.
Good evening, all, here and outside. The questions are: 1, what is the situation in the custodial centers? How are we doing? Are there infected inmates or staffers? The answer is this on that. The officers and men of the Nigerian Correctional Service deserve encomiums for their professionalism, for their very, very high sense of duty, for their diligence and their commitment. How and why? I said it here before, I'm just simply repeating it. What they have done there is almost extraordinary. It's common knowledge that our centers accommodate, our custodial centers accommodate more than the number of inmates that are supposed to be there. I won't be specific now, but that is a well-known fact. So for the officers of the Nigerian Correctional Service to have succeeded in preventing any outbreak, not one person in our care at the custodial centers or as staffers of the service is reported to have COVID-19 so far. Cynics want to say, Rauf, you are here again. What of the reported incident in Bauchi last week? So I want to preempt that by telling you that what happened in Bauchi is this. You know, soon after the lockdown, we had the approval of the president to restrict or prevent visits and admission of new inmates. So, throughout the first phase of the total lockdown, which was in April, we did not allow any visit to the custodial centers, and we did not admit any new inmate into the custodial centers. So this was facilitated by the directive of the president, which the NJC supported, because courts proceedings and operations too were largely suspended. So the pressure, though there, was not high. But with the ease of the restriction, with the relaxation of the restriction, which came into effect at the second phase, June. In response to that, and strictly following the protocol established by NCDC, we selected some of the centers with isolation facilities. So, in the case of Bauchi, some courts on the 4th of June this year remanded some capital offensive suspects, about 14 of them, which we put through the procedure of testing. And the 14 of them tested positive. And they were promptly rejected by the consular center there. But the state government insisted that they had no place to keep them. They were kidnappers, armed robbers, suspects. I'm not saying they have not been convicted. They are suspects of capital offenses. So an agreement was therefore reached between the custodial center officials and state government that they will be kept in isolation unit in the custodial center under the care. The state will be treating them. I mean, the Bauchi state government will be treating them, will be feeding them, but they will be in isolation. So they are not in any way mixed with the regular inmates of the custodial center. They are being managed by our officials and the officials of the state government. That's about that. So what I'm saying in essence is that there is none of the inmates in our charge in the custodial centers that has any manifestation, symptom, I'm going to use your lingo, of COVID-19. I made mention of this in my performance account at the FEC, and I'm equally telling you now that the Nigeria Correctional Service has displayed a high level of dedication, diligence, and professionalism in the management of the custodial centers under his care. That's about that. The second question is about training schools. I could have appropriately just said that, look, let's give it to these people that they are professionals. And for as long as there are protocols already established by NCDC and the PTF, I want to believe they are working in tandem with those protocols, and that that should be enough to give us the confidence that no harm will come to those people who are in training. But I won't just leave it at that. I want to be more specific. By January of this year, 2,211 senior and junior officers of the service began a training program in 5 training centers nationwide, Lagos inclusive. But by April, when the lockdown came, when the total lockdown came, they were all asked to go back to their respective homes. But one thing you must bear in mind is that they are within the region. That is, nobody will come from Kaduna to Lagos. No, the people in Lagos who are in Lagos are officers in the Lagos territory. So with the east lockdown, which began in June, they were therefore asked by the 5th of June to reconvene to complete their training. I said 2011 were on training in January, and were recalled to complete their training in June, on the 5th of June specifically. So far, 1,868 have reported. We are still awaiting 343. Nationwide, not only in Lagos, nationwide, 5 centers. And they have been on the training following the guidelines and protocol established by the NCDC, and the PTF. And to the glory of God, to date, we have not recorded any victim of COVID-19. So your fear should be allayed with that. And I want to conclude by saying that what this time calls for is what our chairman said the last time he spoke here. We must all take personal responsibility for our safety and protection. From personal responsibility on this pandemic, let's extend it to communal responsibility, and so on. So if we are all so prepared, definitely we will manage it as we are cruising on. The world is struggling to combine saving lives and protecting livelihoods. And that is the key to me, that's the key slogan now. As we are committed to saving lives, we cannot equally dismiss the fact that people must live. The lives that we are saving must be able to live. And living is not just breathing. It's earning a livelihood to support your life and those who are dependent on you. The Yoruba of what I've said in English. She asked me Yoruba. She said, I'm saying Yoruba. She said, okay, I'm saying the Yoruba one. I listened to her. She said she want my answer in English and Yoruba. And I can't dress like this and refuse to speak Yoruba. Àkọ́kọ́ ohun tẹ́ bèrè ní pé báwo la ṣe ń ṣètọ́jú àwọn tó wà ní ìpamọ́ torí a lè pé lọ́gbà ẹ̀wọ̀n mọ́ sìn ìpamọ́ àti tún orí wọn ṣe torí correctional center náà ń pè lóyìnbó kò ń ṣọgbà ẹ̀wọ̀n mọ́ ìpamọ́ ìjọba àti tún orí wọn ṣe àwọn tá a fẹ́ kọ́ lọ́gbọ́n tá a fẹ́ kọ́ lẹ́kọ̀ọ́ láti lè rí ayé gbé pẹ̀lú àlàáfíà ìrọ̀rùn tí wọ́n àti tàwọn aráàlú. Ohun tá a ti ṣe ń bẹ̀rẹ̀ o a wà lára àwọn orílẹ̀-èdè tó rí ètò ìtọ́jú àwọn tí ó wà ní ìkáwọ́ ìjọba ṣe tí ò tí ì sí ẹnìkan tó ṣe àgbákò COVID-19 ní àgbáńlá ayé. Àwọn orílẹ̀-èdè tó rí ṣe wọ́n ọ̀pọ̀ o ṣùgbọ́n orílẹ̀-èdè wa ó wà lára àwọn tó rí ṣe tí ò sí ẹnìkan ní gbogbo àwọn tó wà ní abẹ́ ìtọ́jú wa. About 75,000 people ló wà in our consular service, 75,000 people. Kò sí kan nínú wọn tó ní àrùn COVID-19 láti ìgbà tí àjàkálẹ̀ àrùn ti wọ orílẹ̀-èdè wa tí ìgbà tí ń sọ̀rọ̀ yìí. Àwọn 14 tí ìwé ìròyìn sọ pé ó ní lọ́sẹ̀ tó kọjá wọn ò sí nínú ààbò tiwa o. Ìjọba kóòtù Bauchi àwọn ló ní pé ká gbà wọ́n sọ́dọ̀ torí pé ohun tó ń mú wọn fún àwọn ẹ̀sùn tó lágbára ni tó yẹ pé tán bá dájọ́ wọn tán ẹ̀mí ló máa bá lọ. Àwọn ìgárá ọlọ́ṣà àwọn ajínigbé ni wọ́n. Nígbà tó ń kó wọn dé ilé iṣẹ́ wa ní Bauchi a ní pé à ń gbàyàn tá a bá ṣàyẹ̀wò fún. Àyẹ̀wò tá a ṣe fún wọn ló fi hàn yí pé 14 wọn o wọ́n ti láhùn COVID lára. A dẹ̀ kọ̀ wọn aláàlè gbà wọn. Ìjọba bọ́jú wá sọ fún wa yí pé ibo làwọn fẹ́ kó wọn sí. Àwọn ọ̀daràn pọ́nbélé lélẹ́yìí torí ìdí èyí ẹ jẹ́ ká jọjọ ṣe agreement kẹ́ bá bì kan fi wọ́n sí lọ́dọ̀ yín tí wọ́n fi ní ráyè dé ọ̀dọ̀ àwọn tó kù tá a máa ti máa ṣòyọjú wọn fún ara wa. Ohun tó ṣẹlẹ̀ ní Bauchi nìyẹn. Nípa ti àwọn tí ó ń gba ẹ̀kọ́ lọ́dọ̀ wa ní ilé ẹ̀kọ́ 5 tá a ní a fi ń dára ìlú lójú pé kò sí ìyọnu pẹ̀lú wọn torí gbogbo ìlànà tí àwọn elétò ìlera gbé kalẹ̀ là ń tẹ̀lé. Àti ọjọ́ 5 oṣù yìí náà ti bẹ̀rẹ̀ ìdánilẹ́kọ̀ọ́ tá a ní kan ṣe yìí torí wọ́n ti bẹ̀rẹ̀ tẹ́lẹ̀ láti January ìṣẹ̀lẹ̀ ti April ló jẹ́ ká dá ẹ̀kọ́ tá à ń kọ́ wọn dúró wọ́n gbà tán ti wá tán ti fàyè díẹ̀ sílẹ̀ wọn ló mú ká bẹ̀rẹ̀ ní ọjọ́ 5 oṣù yìí wọ́n dẹ̀ ti wà ń bẹ̀ láti gbà yẹn à ń tẹ̀lé ìlànà tó ń fún wa pé a gbọ́dọ̀ tẹ̀lé irú àwọn ìgbìmọ̀ báyìí àdè rí dààmú kọ̀ọ̀kan o wọ́n á ní kí n tó lọ wọ́n sọ fún wa pé ojú ọ̀nàdà kan fi ń ṣọ́rí o wọ́n ní pánsá ò kò fura pásá ò jáná àjà ò fura o àjà jìn ẹjẹ́ àfura ìfura lògùn àgbà ẹ ṣé o.
DG NCA standing in for the Minister of Aviation.
The Chair, Presidential Task Force, honorable members and members of the Presidential Task Force, ladies and gentlemen, good evening. There was a question on the preparedness and the feelers on the opening of the aviation industry on Sunday, 21st of June. About 3 weeks ago, the Presidential Task Force gave the aviation authorities the mandate to get back to them with their readiness to open by any time from the 21st of June. Prior to this mandate from the President Task Force, the regulatory body, the Nigerian Civil Aviation Authority, had developed an advisory circular distributed to the different sectors of the industry. This advisory circular requested all the service providers, which include the air navigation service provider in Nigeria, that is the Nigerian Airspace Management Authority, the airlines, the airports, which include the federal government-owned airports managed by Federal Airports Authority of Nigeria, and some state-owned airports, the ground handlers, approved maintenance organizations, and the approved training organizations. This advisory circular required all sectors of industry to present a restart plan to regulatory body for review and approval. Depending on the business of the service providers, their restart plan is expected to cover airworthiness, operations, passenger licensing, aviation security, safety management system, consumer protection, and air transport regulation. Now, these are the regulatory technical requirements, but most importantly, the COVID-19 protocols under the public health corridor concept. This public health corridor concept was developed in collaboration with the federal health authorities, including the Federal Ministry of Health, NCDC, and the Port Health Services, and also in addition with guidelines from the World Health Organization and other international organizations. Currently, a lot of service providers have provided their restart plans, and these restart plans are supposed to be reviewed by the Civil Aviation Authority, the regulator of the industry. When we review those documents, if we're happy with those documents, then we'll go to each individual organization to verify what they have given as their restart plan. A lot of work has been done. A lot of the service providers have provided very good documents. Some provided inadequate documents, and their documents were sent back to them. Significant progress has been made, but there is still a lot of work to be done. The aviation system normally is a very, very complex system, and this complex system has just been compounded by the public health care concept, which a lot of the aviation system is not used to implement it. Now we have to develop and implement these systems to ensure that aviation industry is not a vector for transmission, mass transmission of the coronavirus. In addition to the aviation system worried about this transmission of coronavirus, it is a statutory responsibility to ensure that operations are safe and secure. The industry has been grounded for close to 3 months now, and we have to ensure all aircrafts are checked, they're airworthy. All pilots will have to check their proficiency and the residency experience is up to date. We have to ensure our security at the airports are up to date, and so many other areas. The proposed date, we never said aviation is going to start definitely on the 21st. We are supposed to put our report back. Based on what we have, we'll have some work to do. As such, June 21st is not a feasible date to resume operations domestic. The Civil Aviation Authority, despite all pressures coming from all quarters, will not approve the start of operations any date until we are sure and we confirm that we are ready to start in a safe, secure, organized, and efficient manner. To do otherwise will be disastrous for all of us. Open the industry when we are not ready and we are guilty of spreading coronavirus, or God forbid we have any incident, I believe the government will come hard on us, and it's going to be counterproductive, and it's going to be disastrous for the industry. We are not too far. We are close, but there's need for time to ensure that we are ready, positively, absolutely ready to start work. The civil aviation regulators had about 4 or 5 stakeholders meeting by Zoom, and we've had feedback from the industry, and we'll respond to their concerns and worries. And also we've had a lot of input from international organizations, such as the International Civil Aviation Organization, ICAO, which is a UN body that sets the standards and recommended practices for the aviation industry worldwide. We take input for them. Also, World Health Organization and international organizations such as the International Air Transport Association, Airport Councils International, Civil Aviation Navigation Services Organization, including the African Union Commission. They also have their high-level task force on COVID-19, which aviation was a significant fact. We have to adopt all this. It's not easy. It's a very complex system. What I can be rest assured, the civil aviation industry will only give the go-ahead when we are ready, nothing before then. As the proposed date, I'm sure, that's the next question. We're looking towards the end of this month. Next week, hopefully by mid of next week, we'll submit a report through the Minister of Aviation to the Presidential Task Force for review and possibly set a fixed date. I know a lot of people are anxious. The industry is anxious. We understand, but to do otherwise will be a great disservice and neglect of our statutory mandate from the government of Nigeria. Thank you.
Honorable Minister, Information and Culture.
Mr. Chairman, and members of the PTF, gentlemen of the press, lóòótọ́ wọn ní Fálànà gbọ́ tiẹ̀ tara ni là á gbọ́ àmọ́ kí n tó tí Fálànà kò tó gbọ́ tiẹ̀ kí n tó gbọ́ ti ẹlòmíì àfi kí n tó gbọ́ tara mẹ́jọ ń gbẹ́ tẹ ẹlòmíì náà gbogbo ìbò tí arákùnrin wọ̀sọ̀wọ̀sọ̀ tó sọ ni pé bàálù ò ní máa fò ní ọjọ́ kọlógún oṣù kẹfà yóò agbọ́ dáadáa. Now to come to the questions that were actually addressed to me. I think it's Rachel that raised the issue of stigmatization. The truth of the matter is that this is an issue that the PTF, especially the Risk Communication Committee, addressed very early on. We addressed this via our testimony, audio and video series, which is still playing on our television and radio stations all over the country. Small fact, what we did was that we took advantage of we actually solicited the assistance and cooperation of those who had tested positive, who had been isolated, and who had recovered, and they gave their testimony in various languages. And I think the message they sent to everybody was that testing positive is not a death sentence. At the same time, they also told in very plain language that COVID-19 is real, and advised everybody to listen to what the PTF COVID-19 is saying, and also to listen to the NCDC. Yes, it's quite unfortunate, like correctly observed, that despite the fact that over 99% Nigerians are aware, or put it this way, 99% of those who were interviewed admitted that they were aware that there's COVID-19. However, 95% of them also said that they've actually listened and they've heard the admonitions of the PTF COVID-19 and that of the NCDC. Yet, as rightly observed, many are not listening, many are not wearing their masks, many are not observing the social distancing, many still have to be found in, mass gatherings. Well, our approach to this is that we will continue to deepen our advocacy programs. We continue to enlist the support of all stakeholders. We have gone far beyond just, using the television, radio, or the new media. We've also gone down to social mobilization. And here, this is where the NOA has been very, very active. But we are of the view that until and everybody takes ownership of this pandemic and this advocacy, very little will be done. And this is why we are enlisting the support of national rulers, faith leaders, and opinion leaders to lead and take possession of our campaign. If they don't take possession of this campaign, we will not be able to achieve as much as we want to achieve. The NOA has gone down to the barest grassroots level, penetrating, the grassroots, even using town criers to let them know that one, COVID-19 is real, and why they must continue to listen to what the NCDC and the PTF are saying. The second question, of course, I think linked to this is the issue of behavioral practice. It's a bit difficult at times for people to change their ways, and this is what we're experiencing. But more important than that, I think, is that many people live in self-denial. They live in denial. They believe, or they want to believe, that COVID-19 is not real. But they wake up every morning to hear the number of people that have tested positive, the number of deaths that have been recorded. And the only time this makes any impact on them is when somebody they know is a victim, or when somebody they know, or somebody who's in their relation is a victim, or somebody who's very well known. Make no mistake about it. Not only is COVID-19 real, but as the chairman said on Monday and repeated today, we've gone past the stage of where our doctors and our nurses are the frontliners. No. They are today our last line of defense. In other words, pray not to get to the hospital. Pray not to get infected. And the only way you will not get infected is by listening to what NCDC is saying, to what PTF is saying. We've repeated several times here that there is no known vaccine, no known medicine for COVID-19. Don't believe what anybody is telling you. As of today, there's no known medicine, no known vaccine. The only known medicine and vaccine for COVID-19 is listening to what the PTF and NCDC are saying, which is, please, please, please wash your hands, use sanitizers, keep social distancing, avoid mass gatherings. There's no other medicine than this. And if you know the experience of those who have gone through this, who are going through this, you will pray never to be infected with COVID-19. I had a very personal experience 3 nights ago when a relation of mine called, and of course I barely recognized his voice. So I decided to talk to the son. And I asked him, "What's wrong with your daddy?" He said, "My daddy," after going around, I said, "My daddy is IDH." And I said, "What's wrong with him?" Of course, it has the COVID-19. He said, "Please, my daddy wants to get out." I said, "If he gets out, where are we going to take him to?" He said, "My daddy has lost hope." He said, "You need to talk to him." I said, "Well, I can talk to him, but I want to tell him that that is the best place he can be." He now told me that his daddy called him the previous time about 1 a.m. And he said, "Daddy, why are you not asleep? Why are you calling me now?" He said, "How can I sleep? I'm not sure that I will last till tomorrow." So I'm just telling you, this is the agony of not just the man who was infected with COVID-19, but also the man, the family. The son is not even where the father is, but he cannot sleep also. The son told me that I'm afraid if there's any call, it's an unknown number, I'm afraid to pick it. I don't know what's going to be. So please, I'm appealing to all of us. COVID-19 is real. And this is the best place we can all be, doing what this, NCDC has asked us to do, or the PTF has asked us to do, which is please keep to the regulations, and we will not be infected. Thank you very much. Now, to answer the question posed to me in Yoruba, which is actually that what are the new guidelines? I think, well, it depends on which one you want, but guideline, àwọn ètò tí àjọ PTF tó ń gbé sílẹ̀ àti NCDC ní wípé tó lóòótọ́ láti sọ pé a lè lọ sóko díẹ̀, a lè lọ sí odò díẹ̀, torí bí àpọ̀rọ̀kọ̀ ti ṣe àlàyé àrùn àjàkálẹ̀ tó wà yìí kò ń ṣe wípé ìlera nìkan ló ń bájà, ó ń bá okòwò wa jà àti jẹ àti mu wa, tàbí sọ pé tó a lè ní pé kí a dẹ̀ síra wa mọ́lé títí àṣà jẹ àṣà mu àgbọ̀ bùkátà la fi ní tò ẹ jẹ́ ká ṣètò díẹ̀díẹ̀ kí àwọn èèyàn kí wọ́n máa lọ síbi iṣẹ́ kí wọ́n máa bọ̀, ṣùgbọ́n tán bá ti ń lọ tán bá ti ń bọ̀ kó rántí pé ewu ìwà ní ọkọ̀ lóńgẹ́ o, ní lóńgẹ́ fún rẹ̀ gan ewu ni o. Àwọn ètò tá a gbé sílẹ̀ ni pé a sọ wípé tó kò séwu mọ́ o, a sọ pé COVID-19 ti lọ, tá a sọ ni pé COVID-19 yìí wà o, ó wà o, ṣùgbọ́n a gbọ́dọ̀ jẹ, a gbọ́dọ̀ mu. Ẹni tó bá sì wà láyé ni ó jẹun, tó wà láyé ni ó mu. So ẹ máa rọra o, tẹ́ bá ti ń jáde o, ẹ máa fọwọ́ yín dáadáa o, tẹ́ bá ń jáde o, ẹ má lọ síbi tí èrò bá ti èèyàn bá ti pọ̀ sí o. Tẹ́ bá wà ní kò síbi tí Ọlọ́run ti ń gbàdúrà o, dandan pé dandan kọ́ ni ká lọ sí ilé ìjọsìn, dandan kọ́ ni pé ká lọ sí mọ́ṣáláṣí láti lọ kírun o, ẹ dúró ní kọ̀rọ̀ yàrá yín o. Gbogbo ẹni tó bá gbọ́ ní tí a sọ yìí díẹ̀ Ọlọ́run á gbé wa lékè COVID-19. Ìta wa sọ ní àìpẹ́ yìí ni tí a fi ètò tá a ṣe sílẹ̀ ni àwọn tí wọ́n wà ní òkè òkun tí wọ́n fẹ́ wá sí ilé tẹ́lẹ̀tẹ́lẹ̀ àti gbégi lé pé tó kó alùpùpù dóbi tó wà, ṣùgbọ́n a rí i pé a lè tilẹ̀kùn mọ́ ọmọ onílé. A sì dúpọ́ lọ́wọ́ gbogbo àwọn tí wọ́n ràn wá lọ́wọ́, tàbí sọ pé gbogbo ẹni tó bá wà lókè òkun bá fẹ́ wá sí ilé, ètò wà kó tó wá yóò ṣe àbẹ̀yẹ̀wò wípé kò ní COVID-19. tó bá ṣe àbẹ̀yẹ̀wò lénìí tó bá ní kò ní COVID-19, ó gbọ́dọ̀ wá sílé láàrin ọjọ́ 14 tó ti ṣe àbẹ̀yẹ̀wò yẹn. tó bá wá dé Àbújá ni o tàbí tó bá dé Èkó o, a gba ìwé ìrìnnà ẹ̀ tá à ń pè ní passport, a gbà sí ọwọ́. A wá ní pé tó bá di ọjọ́ 3 tó délé, lákọ̀ọ́kọ́ tó bá ti dé ilé yóò lọ sí, kò gbọ́dọ̀ bá àwọn ará ilé gbé pọ̀, yàrá tiẹ̀ yóò yàtọ̀, torí ó ṣeé ṣe pé lẹ́yìn ìgbà tó ti ṣe àbẹ̀yẹ̀wò yẹn kó ì ní àrùn COVID-19, yóò dágbé fún bí ọjọ́ 14 tó jẹ́ pé àwọn NCDC wa àti àwọn PTF wọ́n máa bẹ̀ yẹ̀wò, wọ́n máa pè lórí fóònù, wọ́n máa béèrè ṣé ara rẹ̀ ò gbóná, ṣé ò máa wúkọ́, ṣé kò sí nǹkan tí ń ṣe ọ́ lọ́fun. tó wá di ọjọ́ kẹta tó ti dé Nàìjíríà yóò padà lọ ṣe àbẹ̀yẹ̀wò àti ṣe ètò tó bá ti gba passport ẹ̀ lọ́wọ́ ẹ̀ á fún ní ìwé orí ìwé yẹn wọ́n ti kọ hospital tí ó lọ láti lọ ṣe àyẹ̀wò á ṣe àyẹ̀wò yẹn fún ní ọjọ́ kẹta tó bá dé àwa fún ní èsì tá a bá fún ní èsì tó bá yege àwa fún ní ìwé ìrìnnà ẹ̀ padà tó bá jẹ́ pé Kàbà ló ń gbé o tàbí Lọ́kọ́jà ni o ó ṣẹ̀ wá lọ sí ilé ẹ̀ ṣùgbọ́n ìjọba kọ́ ni yóò gba ilé ìtura fún o tí ó bá ti dé yóò wá bí tí yóò gbé ṣùgbọ́n ó gbọ́dọ̀ ṣe self isolation tó bá di jọ́ kẹta tí wọ́n bá ní tò èsì ẹ̀ jáde tó wá jẹ́ wípé ó negative ó ti yege ó lè má ní láti tó bá yẹ pé ó yege kò ní láti dúró fún ọjọ́ 14 kó tó tún padà lọ sí ilé ẹ̀ tàbí kó tó máa bá àwọn ará àdúgbò ṣeré jẹ́ kí n tún sọ ẹ jẹ́ n sọ dáadáa o tó bá dé sí ilé ọkọ̀ òfurufú wọ́n á gba ìwé kó tẹ̀ tó kúrò lọ́hùn náà yóò kọ́ ṣe àyẹ̀wò tó bá ṣe yẹn wọ́n á rí wípé kò ní àrùn COVID-19 bọ̀ tó bá ṣe àyẹ̀wò ní èní tí ò wá sílé lẹ́yìn ọjọ́ 14 àyẹ̀wò tó ṣe yẹn ó ti bàjẹ́ á tún ìmí ṣe ni o tó bá dé sí airport wa lẹ́yìn ìgbà tó ti gba ìwé ẹ̀rí pé kò ní COVID-19 tó bá ti dé wọ́n á gba ìwé ìrìnnà ẹ̀ tó jẹ́ passport ẹ̀ wọ́n á gbà sílẹ̀ wọ́n á fún níwèé kékeré ìwé kékeré yẹn á sọ fún wípé tó bá dijọ́ báyìí ìjọ́ kẹta tó dé yẹn wọ́n á sọ hospital tí wọ́n lọ ṣe àyẹ̀wò míì but láàrin ọjọ́ mẹ́ta yẹn wọ́n á ní kó jọ kó máa kọ́yẹ́pọ̀ nìkan ni kó má bá àwọn ará àdúgbò lòpọ̀ púpọ̀ torí àyímọ̀ kó má tí kó àrùn yẹn lẹ́yìn ọjọ́ mẹ́ta tí wọ́n bá rí i pé ó yege tí ò lárùn ó ti yege nìyẹn kò sí tí kò lè ṣe kò ní tí òbí tí ò lè lọ àfi kó máa kíkù òfin ṣùgbọ́n tó bá wá jẹ́ pé lẹ́yìn ọjọ́ mẹ́ta yẹn wọ́n ní àrùn yẹn wà lára ẹ̀ nígbà ẹ̀ ni àwa sọ pé ó gbọ́dọ̀ lọ fún self isolation tó bá yẹ pé hospital náà ni àmú wá sí hospital tó bá yẹ pé àwọn tó ń sẹ̀ ti máa dúró ní ilé láti tọ́jú ara wọn ni wọ́n á ṣe ètò fún ẹ ṣe púpọ̀.
Thank you. Finally, we call the chairman of PTF to the podium. SGF, sir.
Go ahead.
Ẹ má bínú o torí mi ò fẹ́ kí ó dàbí ẹni pé láì ó tún parọ́ ni o. Parọ́. Wọ́n ní pé tó bá dé bó ṣe ń dé báyìí bí mo ṣe sọ kó tó kúrò ní ìlú tó ti ń bọ̀ ó gbọ́dọ̀ ṣe àyẹ̀wò yẹn tán bá ní pé kò lárùn ni ó tó wọ ọkọ̀ bàálù tó bá dé Nàìjíríà yálà Èkó ni tàbí Àbújá wọ́n gba pásítọ̀tì ẹ̀ lọ́wọ́ ẹ̀ wọ́n ní kó lọ ṣe àyẹ̀wò míì ní ọjọ́ kẹta wọ́n wá ní tó bá tẹ̀ negative gan ọjọ́ 14 ni ó self isolate ni ó dàgbé ní inú ilé ẹ̀ o tó bá jẹ́ pé ó yege kò míì pé yóò máa bá àwọn ará àdúgbò lò pọ̀ ó yẹ máa dágbé o but tó bá yẹ pé kò yege wọ́n mú kúrò bóyá hospital ni wọ́n mú lọ ẹ ṣé púpọ̀.
Okay. We had to allow the Honorable Minister for Information sort his Kwara Yoruba, which is slightly different from Minister of Interior's dialect. AIT, you asked about the payment of allowances. These are just administrative matters. They take time either through the processes of negotiation, like the one that has just been concluded by the Ministry of Health with the health workers. Basically, all of us, including you, at least at the end of the month, we collect our salaries. Allowances are just an addition on top of the salaries, and they all go through processes. But I can assure you that once government has made a commitment of paying, it will definitely come. So there shouldn't be any anxiety about whether they will collect their allowances or not. I believe the commitment that has been made will be attended to. You know that the budget had to go through some bit of revision. It's still undergoing that process. Hopefully, by the time the National Assembly reconvene, it will be signed. I mean, they will pass it at a joint after they have harmonized, and it will be transmitted to the President for his assent. Once that is done, the application of the funds will flow much easier. So these are administrative processes that I believe is ongoing, and it will meet the expected or meet the expectations of our officers, our men and women who right now are busy working so hard to ensure that we overcome the current health challenge that is confronting the entire world. Mitare, you asked about the need, whether we should consider having a PTF desk for the purposes of complaints. That will be usurping the responsibility of the Ministry of Health, which has a Department of Hospital Services. I hope I'm correct. That should be their responsibility. We are a task force with a limited period of time of operation. The first schedule of time that we've been assigned is 6 months, start to finish. Yesterday was 3 months. So technically, except if we have presidential approval to extend at the end of the next 3 months, the lifespan of the presidential task force will come to an end. But COVID-19 will not be gone in the next 3 months. Let's be honest. So institutions of government that are charged with the responsibility of managing our healthcare system will continue to run the process. So I believe that the appropriate department to open the help desk for the purposes of receipt of complaints and attending to complaints, especially for people who are often turned back when they go to the hospitals in search of medical care, should be the Department of Hospital Services in the Ministry of Health. The other two questions, let me start with the one by Friday. With regards to the strike action by the Association of Resident Doctors as to whether we had intervened. As a task force, we have not intervened. But as a government and as a ministry charged with the responsibility, I believe the Minister of Health and his Minister of State and the Minister of Labor and Employment have been in constant engagement with the Association of Resident Doctors as to their plight and to the decision to withdraw their services at this moment. I would want to make an appeal to the resident doctors to be very considerate about the plight of Nigerians at this moment. We are dealing with a public health matter. So it affects everybody. And to consider the appropriateness or the propriety of withdrawing services at this time on issues that were negotiated some 6-7 years ago. Because I had some of the issues that are being raised for the purposes of consideration and settlement now were decisions that were reached in 2014. I stand to be corrected. Decisions that were reached in 2014. Some were reached after that. If we did not bring a finality to that, in terms of timing, I would want them to consider this. Is it the appropriate time to take such very drastic and adverse measures that would have the tendency of affecting all of us? Like the Minister of Health rightly observed, we all have relatives, we all have loved ones. Even amongst the resident doctors, I had one of their officials saying that over 200 of them have been infected in the course of their work attending to patients. So what happens to the care of these 200 plus of their members if at this moment they will withdraw their services? How would they be cared for? Who would help them manage this very difficult period, this very complicated period, when you have too many things running in your head as to whether you would survive or not survive? So my appeal to them is that, yes, they might have legitimate claims, which every employee has, but I want them to consider the appropriateness of the timing, whether this is the best time to press so hard their demands at the expense of exposing the entirety of our people to the perils and the scourge of COVID-19. I believe the National Assembly has intervened, and the Minister of Labor and Employment, who is the chief mediator of the government, has also intervened. If at any moment our intervention as a task force will be required, we will not hesitate, because we believe this is not the time, and we must get everybody to be on board to ensure that we provide the minimum of the services that our people require. Stigmatization. Rachel, I get really worried when I hear that people are stigmatized as a result of infection with COVID-19. This is a virus that has decided to defy boundaries, to travel all over the world, and it's ravaging every known economy and health system. And by getting infected, you are stigmatized. I still remember vividly the experience shared by a health worker in Jigawa on national television. He got infected in the line of duty as a nurse. And when he recovered, he went back home. In the morning, he went to a mosque. As a matter of fact, the first experience he had was that when he came out of his house to go to the mosque in the early part of the morning to say his morning prayers, people that he knew were dodging him. After he said his prayers and he returned home, a professor, somebody who has risen to the point of being a professor, called him on the phone and advised him not to return to the mosque. And he was sharing this on national television. Am I the only person that heard about it? That I consider very, very, terrible. Called him and advised him not to return. But I was glad when I saw the chief imam of the central mosque in Dutse saying that that was an Islamic, it was not proper, that such a person requires all the support from the community so that his recovery process will be total with the support of the community. So I believe at this moment we cannot afford to stigmatize our people. You may care to know that almost 80% of people that are infected are in no form of isolation center or hospital. We're just caring for about 20 people that have decided to show up or provide themselves when they are critically ill for the management and care. Most people, one of the reasons why they decide to avoid the isolation centers or don't present themselves until it is late and complications begin to develop is because of this simple reason of being rejected, of being treated differently. So my appeal to all of us as Nigerians, that there's no point stigmatizing anybody because he's infected with coronavirus. It's a disease that has defied boundaries. The high and mighty are afflicted. The low and downtrodden are afflicted. The rich are afflicted. The poor are afflicted. It has no respect for anybody, either gender, creed, or nationality. It started in China. We had no business having it here. But it has gotten here. I think at this point, all we need to do is to prepare and make sure that we do everything that will help us as a nation and as a people overcome this deviant virus. When we started was one on the 27th of February. Today, we have a record number of over 17,000. How did we get here? And it's still counting. And the truth about it is that the adverse effect of these numbers will not be seen now until 3 weeks ahead. That's when you begin to see the projections of the mortality. Until 3 weeks ahead. Because it takes that length of time to go through the processes of incubation and the adverse effect of it. So we have got hard days ahead. We've got tough days ahead. So we need everybody to understand that we are not out of the woods yet. I drive sometimes when I'm coming to the office in the morning, I see people casually, they will put the mask under their chin here. That's even when they care to carry it. And people go about their businesses as if there is nothing to dread. Look, gentlemen of the press, there is so much to dread. You know, as much as I do, the number of people that you know in Abuja that are afflicted with this virus. You know. You know a lot of people that are in self-isolation in their various homes. You know them. So these statistics of mortalities or fatalities, it's not a figure, it's not a statistics. You can place names and faces to these numbers. I can. I can place names and faces to these numbers. some of them colleagues, some of them very good friends, some of them from my community, some of them classmates, people who have enjoyed relationship and fellowship with in the last 40, 45 years, have fallen victims to the coronavirus. And you know, you have people too, friends, relatives, loved ones. So this is the time that we need to build a hedge of relationship around ourselves and support each other and make sure that because of coronavirus, nobody should suffer any form of stigmatization. That's my appeal to all of us, because there are more difficult days ahead. There are harder times ahead as our figures begin to rise. When I hear people talk about the second wave, we have not finished with the first wave. We're not even through. We've not even peaked. We've not even peaked. So don't talk about the second wave. Let's deal with the first wave. So there's so much work to do. And for those of you that come here 2 or 3 times a week, like we have decided to reschedule now, you are doing it at great pains, at a great risk. So if anything should happen to any of you or any of us on this device, should be a subject of stigmatization because we are paying the price. You are serving the nation by turning up every day here. Those of you that are standing with the cameras, you are serving the nation. And there are so many people that are serving the nation. And like Dr. Brian, the Filipino doctor said, that health workers have ceased to be frontliners anymore. They are our last line of defense. So you have become the frontliners. We are the frontliners now. And the best we can do for ourselves and our loved ones is to ensure that we don't get to the last line of defense. Because basically what he's saying is, do everything you need to do not to get to us in the hospitals. Because we are now the last line of defense. But it is your responsibility to ensure that you don't get to a situation where you get to the line of defense. Thank you, and have a wonderful weekend.
Thank you very much, Chairman PTF. That brings us to the end of today's national briefing. A number of announcements. First is the fact that, and this is to the public out there, please, the PTF is not recruiting. And there was a radio program in Abuja today. I've just received reports on that. And somebody phoned in that PTF engaged them, but they have not been paid. Somewhere in Gwagwalada, the phone call came from Gwagwalada. So scammers are out there. PTF does not recruit, will not recruit, has never recruited. So please don't let anybody scam you out there. It's very, very important. 3 months down the line, human resistance to change and behavior remains a major problem. Stigmatization is a major impediment to our efforts to detect, to test, to trace, to isolate, and to treat. It impacts on the esteem of the people who test positive or are being treated for COVID-19. Indeed, they are not victims. They are people. They are human beings like us, to be respected and loved. Stigmatization can drive people to hide the illness to avoid discrimination. Some may never seek medical help, resulting in uncontrolled spread of the virus. Let us stop stigmatization. Let us be positive and be encouraging with our words and our attitude. Stopping stigmatization is critical to making communities and members resilient. It will support our focus on community engagement and risk communication. Finally, please remember that the virus does not discriminate. People do. Together, as a nation, we can stand against COVID-19. Let us change our attitude. Let us change our language. Take responsibility. I thank you very much. We hope to see you. God bless Nigeria. We hope to see you on Monday.